Good morning, all. I'm Tim McKnight, Dr. McKnight. I am the Executive Director of the Pathways to Practice program here at Cleveland State University. I want to welcome all students who have joined us today. We will be recording this session, and today we're hosting a info session on basically how to pay for graduate studies, that including medical school, nursing school, and PA school. And today we've invited representatives from HRSA, and they will be speaking on the National Health Service Corps Scholarship Program. So I would like to certainly welcome any pre-medical students from Cleveland State who have joined us, any nursing students who have joined us from Cleveland State. We also invited medical students from NeilMed, as well as OU Heritage Osteopathic Medical School. And we will be sending out this recorded session to all those who have been invited, which will also include pre-med students from Lake Erie College, as well as graduate students from Duquesne University. Today's speaker will be Chris Gallup. He is the chief of the DNHSC Scholarship branch for HRSA, and he will be guiding us throughout this today's presentation. So without further ado, Chris, I would like to open up the microphone to you, sir.
Well, thank you so much, Dr. McKnight. Hello, everyone, and thank you so much for joining us today for our Got Debt, No Sweat info session, which will focus on scholarship and loan repayment opportunities through the National Health Service Corps and Nurse Corps programs. As mentioned, my name is Chris Gallup, and I'm the chief of the National Health Service Corps Scholarship Branch, which manages both the National Health Service Corps Scholarship and Students to Service Loan Repayment programs. I've worked with the National Health Service Corps for the past 12 years and take great pride in our efforts to connect qualified healthcare professionals to communities in need. Pursuing health professions training can be costly and stressful. During today's info session, you will learn about the financial benefits of our programs, which can reduce some of the stress involved with pursuing health professions training. You'll also learn about the eligibility requirements and service commitments for our programs to help you determine if this is the right opportunity for you. We'll go to the next slide, please. Thank you, Tony. So today, and again, a big thank you to Dr. McKnight for coordinating this effort and doing all the outreach and getting us connected. Myself, of course, will be presenting, and we'll have a great video from one of our program participants, Dr. Brian Freeman. With that said, let's start with an overview of the National Health Service Corps to give you a better sense of who we are. So for more than 50 years, the National Health Service Corps has worked to build healthy communities by supporting qualified healthcare providers dedicated to working in areas of the United States and its territories with limited access to primary healthcare, regular dental and behavioral healthcare, and preventative screenings. Our goal is to improve access to these crucial services by connecting our program participants to health professional shortage areas across the country. While our health professional shortage areas receive the benefit of access to care, our program participants have the opportunity to pay off their health professions educational student loan debt in exchange for their service in a high-need area through our scholarship and loan repayment programs. The impact of our programs is impressive. We currently have over 20,000 National Health Service Corps clinicians providing care to almost 21 million people in the United States and its territories. We'll go to the next slide, please. So here we have an overview of each of our National Health Service Corps programs. We have programs available for students through our scholarship and Students to Service Loan Repayment program, as well as programs available for fully trained clinicians through our loan repayment programs. Starting in the top left, first, the National Health Service Corps Loan Repayment Program offers up to $50,000 to repay health profession student loans in exchange for a 2-year service commitment to work at an NHSC-approved site in a high-need, underserved area. Next is our National Health Service Corps, which is still on the same slide. My apologies, Tony.
Oh, sorry.
No worries. One more down. Yep. So next is our National Health Service Corps Substance Use Disorder Workforce Loan Repayment Program, which was launched to combat the nation's opioid crisis. Through this program, awardees receive up to $75,000 to repay their health profession student loans in exchange for a 3-year service commitment to work at an NHSC-approved substance use disorder site in a high-need underserved area. The third entry on our list is our Rural Community Loan Repayment Program. This is a partnership with the Rural Communities Opioid Response Program, which provides dedicated funding for rural communities impacted by high overdose rates as identified by the Federal Office of Rural Health Policy. The NHSC Rural Community Loan Repayment Program provides up to $100,000 in student loan repayment in exchange for a 3-year service commitment to practice within the most vulnerable, high-risk counties in America. Next is our NHSC Scholarship Program, which may be one of the most relevant programs for those in our audience today. The NHSC Scholarship Program pays tuition and other educational expenses for students pursuing primary care careers. When they graduate, they will go on to serve in an underserved, high-need rural or urban community. Scholarship support includes tax-free payment of tuition and required fees, an annual other reasonable cost payment, as well as a monthly living stipend, which is actually taxable. The fifth program is the NHSC Students to Service Loan Repayment Program. The NHSC Students to Service Loan Repayment Program provides up to $120,000 to eligible students pursuing a health professions degree. To be eligible for the Students to Service Loan Repayment Program, you must be enrolled as a full-time student in the final year of a fully accredited school in an eligible degree program. And we'll dig into the eligibility requirements a little bit more in the future slides. I'd also like to mention here that we currently have an application cycle open for the Students to Service Loan Repayment Program. That application cycle is open through December 7th. So if you just happen to be a final year student joining us today, you would be eligible for that program and have a full 30 days left to consider submitting an application. Lastly, with the programs on our list is our NHSC State Loan Repayment Program. The State Loan Repayment Program provides cost-sharing grants to states and territories to operate their own loan repayment programs. The grants to states are awarded for a 4-year period. And in FY22, we awarded over $100 million in grants to 46 states, Washington, D.C., and 3 U.S. territories. We'll go ahead and go to the next slide, please, Tony. Thank you. So now that we've given an overview of the National Health Service Corps and its programs, we'll highlight and take a deeper dive into our student and clinician-based programs, while also taking a look at some of the support and resources that we have available for our program participants. We'll go to the next slide, please. So again, our student-based programs are likely the most immediately relevant for our audience today. These programs are for aspiring clinicians who are quite certain that primary care will be their final practice destination. We can go ahead and go to the next slide, please, Tony. Thank you. So digging a little more into detail regarding our scholarship program, we wanted to share with you the eligibility requirements as well as the service commitment associated with the program. For the scholarship program and really all of the programs that we'll discuss today, individual applicants must be a U.S. citizen or national. You must be a full-time student at an accredited school pursuing one of several different degrees that we have listed on the slide. Of course, we accept physicians, which are both allopathic and osteopathic physicians. You can be pursuing a degree in dentistry. You can be pursuing a degree as a nurse practitioner, a certified nurse midwife, or a physician assistant. So all of these particular degrees are eligible for our National Health Service Corps scholarship program. Of course, physicians are required to complete a postgraduate training in an accredited primary care program. We also strongly encourage our dentists, advanced practice registered nurses, and physician assistants to pursue a postgraduate training, but of course, that is not necessarily required. The scholarship service commitment can range from 2 to 4 years. Generally speaking, the number of years of service that you need to provide will match the number of years of support that you receive. So individuals can sign up for 1 to 4 years of scholarship support, but we do have a 2-year minimum service commitment with the program. We had touched a little bit on the benefits of the program, of the scholarship. I often refer to it as the Cadillac of scholarship programs. The scholarship pays full tuition and fees. We will pay an annual other reasonable cost payment for items like books, health insurance, and equipment. And then we have a monthly living stipend, which is about $1,500 right now. And that is the one component, the only component of our scholarship that is taxable. We'll go ahead and go to the next slide, please, Tony. Thank you. Next, zooming in a little bit on our Students to Service Loan Repayment Program. And again, we are currently accepting applications through December 7th. Running through the eligibility requirements here, once again, you do have to be a U.S. citizen or national. You must be a full-time student in the final year at an accredited school. We really accept the same degree programs in our Students to Service Loan Repayment Program as we do in our scholarship program. That includes physicians, both allopathic and osteopathic, individuals pursuing a degree in dentistry, nurse practitioners, or certified nurse midwives. I would note that I know that we may have some individuals in our audience today that are pursuing an RN degree at the undergraduate level, and we'll have some information about our Nurse Corps Scholarship Program a little bit later in the program, in the discussion, which you may or may not be eligible for. The final requirement for that Students to Service Loan Repayment Program is that, of course, you must have unpaid government or commercial loans for school tuition, reasonable educational expenses, and living expenses. And those debts do have to be segregated from any other debts. So you can't really have a car loan consolidated with educational loans. That would not necessarily be eligible. As mentioned, through this program, you can receive up to $120,000 in loan repayment funding. And the service commitment that comes with the award is 3 years. I'd mentioned we say up to $120,000, and it really just depends on how much eligible debt you have. If you have educational loans totaling more than $120,000, of course, you'd receive the maximum award amount. We will go ahead and yes, thank you so much. You are a mind reader, Tony. Excellent job. Thank you. So this year we are super excited with the Students to Service Loan Repayment Program that we have added a maternity care target area award enhancement. This is an optional award enhancement of up to an additional $40,000 in return for a service commitment in a maternity care target area with a MICTA score of 16 or higher. This has been one of the Department of Health and Human Services efforts in recent years is to further support these maternity care target areas. So again, we are offering up to $40,000 in additional loan repayment funding. That would take a maximum award amount for an eligible discipline up to $160,000. We've listed our eligible disciplines there. These will be family practice physicians with an OB specialty, physicians with an OB-GYN specialty, or certified nurse midwives. Those 3 different categories do qualify for that additional $40,000 in loan repayment funding. Thank you. So it's important to note that with our student-based programs, so both the scholarship program and the Students to Service Loan Repayment Program that we just talked about, we do need to be sure that we have that primary care is going to be your final practice destination. We know that sometimes when you're just starting your medical education training, you may be undecided as to what your specialty will be in the long run. So if that description sort of fits you, we encourage you to hold off. Don't necessarily apply for the scholarship or students to service loan repayment programs, simply because you may not go into primary care, and we wouldn't want you to have to pay back all the money that we've awarded to you. Uh, Otherwise, we have different entry points into our programs. We've got several loan repayment programs. So again, if you're just going into school, not sure if primary care is your final practice destination, we would encourage you to hold off and perhaps apply to one of our loan repayment programs. We'll go ahead and go to the next slide, please, Tony. Thank you. So we wanted to share with you sort of a testimonial from one of our Students to Service Loan Repayment Program participants, Dr. Brian Freeman, who was awarded in past years. He's going to talk to you a little bit about his experience with the National Health Service Corps.
I went to college and wanted to do biomedical engineering. But it wasn't until my third year of medical school that I got out into the communities where I actually saw patients, that I saw that I really had a love for this type of medicine, for primary care. And so for me, it was a decision, what is it that I really wanted to do? My heart was in the primary care. I'm Brian Freeman, NHSC Student to Service Loan Repayment recipient. Right now, I'm a third-year family medicine resident here at Fairfax Family Practice. I'll be looking forward to start my service commitment. My immediate goal is to get into an environment with the National Health Service Corps that I can see myself in for longer term. I actually look forward to it because working with underserved populations, you get to see things with these populations that you don't see in affluent populations. And how long were you congested for when you were pregnant? Especially in primary care, you need to be able to communicate with the wide range of people from all different socioeconomic backgrounds and conditions. Have fun with those babies.
All right, thanks.
Underserved communities means to me working with these people to fill a gap, to allow them to have good health care just like anyone else would. In primary care, especially family medicine, we are their one-stop shop about 90% of their health care needs. We say it all the time here in family medicine, it's that relationship that you have with the patients. And it's cliche, but it's not really cliche, because if you have a good relationship with the patient, you can stave off a lot of healthcare concerns that the patient has. Up on your toes and down. Good primary care is primary care that you are actively involved and are the patient advocate.
Great, doctor. Thank you very much.
Primary care has that challenge and how to attract people to come to the field when student loans is such a big issue. And that's why this program is so great, the National Health Service Corps. Money is a consideration for 100% of our medical students in this country. I like primary care, but I'm not going to make enough money to pay off my loans. This new program by the National Health Service Corps is called the Students to Service Program, which was great because it wasn't a scholarship program where you had to be committed to it in med school. It's something that you can apply during your fourth year when you're already applying to residency anyway. And so for those of us who are applying to primary care fields, this program is excellent because it gives you the ability to practice what you love to do, but then not have that financial burden associated with it. I thought it was perfect. When I got the email saying that I had received one of the awards, $113,000, it literally was a huge sigh of relief because now I recognize, man, my financial burden is almost gone. Last month, we welcomed my first child, a daughter, to the world. Her name is Amaya, and she's been a great joy for us. A lot of work, but a lot of joy. I know now that we can start saving for college education, thinking about getting a house when I get out of residency as opposed to staying in apartment living for several years afterwards. And so it really just frees us up to do the things that we like to do. The benefit of being in the National Health Service Corps is seeing the widest possible range of patient populations, of disease states, of clinical conditions, of socioeconomic backgrounds. That will make you able to be a better communicator, a better leader, a better administrator, because you have a wide range of experience. It's a good way to give back to my community that's helped me growing up. Personally, I can say that a lot of my family, my cousins, my extended family, my grandparents, and my parents when they were growing up too, are underserved. They're from rural or very urban inner city communities where the access to healthcare is not good. I get to serve this population who do a lot for all of us. I only feel it appropriate for us to help them with their health care as well.
Thank you so much, Tony. So
I
I
went to
think
college.
I think Brian is really a great example of an individual who, as they went into their health professions training, they weren't quite sure that primary care was their final destination. As they evolved through the health professionals training, they learned that primary care was certainly going to be their final practice destination, and they applied in their final year of school for the Students to Service Loan Repayment Program. Now, the benefits, I must admit, for the scholarship program are probably the most robust. So, if you're quite certain primary care is your final practice destination, I would definitely encourage you to apply to our scholarship programs. The application cycles for the scholarship programs typically open each spring. With that said, we're going to jump into some of our clinician programs next. And again, these programs, they're in a sense, they're a little bit safer in that, if you're not sure where your final practice destination is, finish up your health professions training and then consider applying to one of our clinician-based programs. We'll go ahead and move to the next slide. Thank you. So this we'll start with our original loan repayment program. Once again, you're going to see a common theme here under the eligibility requirements. You do have to be a U.S. citizen or national. With this program, you're actually going to seek out and apply to work at an NHSC approved site as you're applying for the program. You must, of course, have unpaid government or commercial loans for school tuition, reasonable educational costs, and reasonable living expenses that are segregated from other debts. And then, of course, you have to be licensed. Through this program, you can receive up to $50,000 for a 2-year service commitment. You also have the opportunity to apply for what we refer to as continuation contracts. And over time, you could certainly pay down all of your educational debt. The eligible disciplines we have listed there at the bottom of the slide. I won't read through them all, but it is a little bit wider, so to speak, as opposed to our scholarship and students to service loan repayment program. They include other degree programs such as psychologists, licensed clinical social workers, psychiatric nurse specialists, marriage and family therapists, so on and so forth. We'll go ahead and go to the next slide, please. Next, so here's the program. We take great pride in our ability to sort of react to healthcare trends across the nation. As we know, in recent years, the opioid crisis has gotten worse and worse in our communities. As such, we've stood up the Substance Use Disorder Loan Repayment Program. Through this program, you can receive up to $75,000 in loan repayment funding for a 3-year service commitment. Once again, you do have to be a U.S. citizen. We have the eligible providers listed there, very common themes. The unique piece on this one is that you must be trained and licensed to provide SUD treatment. We do have priority that is given to applicants that are currently providing care in an opioid treatment program, and those who have a license or certification in substance use disorder interventions, such as a master's level substance use disorder counselor's training. We'll go ahead and go to the next slide. The next program that we'll zoom in a little bit on is our Rural Community Loan Repayment Program. This program has a similar goal as to our substance use disorder program. We are focused on individuals that are trained and licensed to provide SUD treatment. The unique difference here is that we do require that you go to a rural community rather than one of just any of our NHSC approved sites, which could be in urban, rural, or even tribal communities across the nation. In this program, you can receive up to $100,000 for a 3-year service commitment. Okay, so as we had discussed earlier, and again, we know that we may have the potential for some individuals that are currently enrolled in an undergraduate level RN program. We'll zoom in a little bit on our Nurse Corps programs. We'll go ahead and go to the next slide. Thank you. So the Nurse Corps offers programs to help address the shortage of nurses across the country. These include loan repayment to nurses who work in facilities experiencing a critical shortage of nurses, also loan repayment to nurse faculty, and then scholarships to students enrolled in or accepted for enrollment in nursing programs. Go ahead and go to the next slide, please. So the Nurse Corps program offers loan repayment to nurses who work in health centers, rural health clinics, hospitals, and other facilities experiencing a critical shortage of nurses, and to nurse faculty who teach full-time in eligible public or private schools of nursing. Go ahead, go to the next slide. Thank you. Zooming in a little bit on our scholarship program in the Nurse Corps, the Nurse Corps offers scholarships to nursing degree students who commit to practice at healthcare facilities, once again, with a critical shortage of nurses upon graduation. Through that program, it's very similar to our NHSC scholarship program. You will incur a service commitment really based on the number of years of funding you received. Right there on our slide, we've got a great link to more information about our Nurse Corps program. We'll go ahead and go to the next slide, please. Very good. Thank you so much. So at this point, we will, as mentioned, we have been around for 50 years, and we're going to zoom in a little bit on some of the great support and resources that we have for our program participants. So the National Health Service Corps recognizes that all of our program participants have made the commitment to be on the front lines of healthcare delivery in rural, urban, and frontier communities. As a result, we believe it is imperative to provide them with the resources and tools to help them prepare for the population demands and models of care in health professional shortage areas. Earlier this year, we established an initiative aimed to empower clinicians for resiliency and transformative care. Throughout participation with the National Health Service Corps, you'll be strongly encouraged to access the compendium of resources that will help establish keen awareness of emerging healthcare trends, provide networking opportunities and mentorship with other National Health Service Corps participants, identify the best multidisciplinary practices that focus on care integration specific to the needs of the community. And we also promote clinician resiliency efforts and resources that assist in recognizing symptoms of burnout aimed to promote clinician well-being. These days, really with every position, burnout is a significant factor, and it's our effort to provide support to individuals that are out there in the field, working hard every day, providing healthcare to the great people of our nation. We'll go ahead and go to the next slide, please. Some more information about our Empowering Clinicians effort. National Health Service Corps participants will receive invitations for webinars and NHSC-sponsored engagements that will be anchored by 3 areas of interest. And that includes clinician well-being and self-care, fostering organizational resilience, and of course, a focus on social determinants of health and health equity. During your participation in these scheduled activities, you will hear firsthand experiences from providers currently serving in health professional shortage areas. You'll also participate in virtual grand rounds and case studies and presentations and research from thought leaders in the healthcare industry. The National Health Service Corps aims to connect quality providers to communities in needs, and participation in this initiative really helps us accomplish that goal and improve the access to equitable care in areas needed most. We'll go ahead and go to the next slide, please. So we also have our Health Workforce Connector. The Health Workforce Connector is a recruitment tool that's used to connect National Health Service Corps members with job openings at approved NHSC sites and facilities. Job seekers and approved sites can use the connector to easily search for and find eligible matches for specific disciplines, health professional shortage area scores, and locations. And I would just emphasize that We really have health professional shortage areas across our great nation. They are in both urban, rural, and tribal areas throughout the nation. We'll go to the next slide, please. Thank you. So I'll take a bit of a pause here. Here we have a QR code that you can certainly scan and that can be used to sign up for notifications regarding application cycle opens. It's super important to get connected with a program. You certainly want to know when that application cycle opens and closes. By using this QR code, you can visit our site and sign up for notifications regarding openings of our application cycles. That includes our scholarship programs and our loan repayment programs. I'll pause for just a minute here just to give everyone an opportunity to scan the QR code if you'd like to. And I think, Tony, we can go ahead and go to the next slide, please. So here on the side, we've got some contact information. One thing that I like to highlight on this slide, if you're an applicant, you don't necessarily have an NHSC or Nurse Corps account just yet. If you're applying to the program and have any difficulties while creating your application, we have our customer care center that is open Monday through Friday, 8 a.m. to 8 p.m. Eastern time, except for national holidays. We also have a robust website that can be visited using the link there in the chat. And then, as mentioned, our health workforce connector as well. We'll go to the next slide, please. Thank you. So at this time, we really want to kind of open up the floor. If we have any questions from our audience, of course, questions can be about our loan repayment or scholarship programs. I know we've discussed several different programs today, and we certainly want to offer an opportunity once again, just to open the floor for a little while to see if anybody has any questions regarding the information presented today.
Hello, this is Sharon Saunders, and I will be moderating the Q&A segment for today's session. So happy to unmute you if you want to put your hand up, or if you want to use the Q&A function at the bottom of your Zoom screen, you can type in your question and we will respond to your question verbally. And again, as Chris said, you can post questions to any of the topics that were covered today. So I'll give that a moment and see if there are any questions that show up.
And I know in the meantime, Sharon, we may have had some pre-submitted questions that we could run through.
Sure. So actually, if you could, to again reiterate, for the Students to Service Loan Repayment Program that's currently open, what disciplines or which disciplines are eligible for that program?
Yeah, that's a great question, Sharon. Thank you for that. So we have physicians that are eligible for that program. Once again, both allopathic and osteopathic physicians are eligible. Physician assistants are eligible for the Students to Service Loan Repayment Program as well. Dentists, who often have a lot of educational debt out there, are eligible for the program. And then finally, nurse practitioners and certified nurse midwives. These are both advanced practice nursing degrees. They would be eligible for the Students to Service Loan Repayment Program as well. One thing that I would definitely want to highlight as it relates to that Students to Service Loan Repayment Program is that eligibility criteria that you must be in your last year of school this year. That is an important one. It's we're sort of catching folks as they graduate there. And once again, we know that individuals going into their health professions training, they may not be completely certain that primary care is their final practice destination. The Students to Service Loan Repayment Program is probably the first opportunity where you're almost fully committed at that point to primary care to jump in and receive a loan repayment award.
Thank you, Chris. I wondered if I could toss that same question over to our counterparts in the Nurse Corps area. So for the Nurse Corps Scholarship Program, what are the eligibility requirements or disciplines are eligible for the scholarship program for Nurse Corps?
So for the Nurse Corps Scholarship Program, you have to be accepted into a nursing school. So either a registered nurse or a nurse practitioner. Mainly, we also have midwives and LPNs, but the main goal is that you are accepted, you have been accepted into a nursing school that is accredited.
Thank you so much. So this question again is for Chris on the S2S loan repayment program. What types of loans are eligible for repayment? Could you go through that again?
Absolutely. So really anything within the educational realm, right? So you may have student loans out there for tuition and fees. You may have student loans out there for other educational costs. You may have student loans out there for living expenses. The big caveat here is, and we know that often as you get to the end of your educational training, you're going to be reached into by lenders wanting to consolidate your debts and give you a better interest rate, which is usually a great idea. But we do need to be sure that if you're applying to the Students to Service Loan Repayment Program, or any of our loan repayment programs for that matter, that you have not consolidated any non-educational debt into a loan, right? So that consolidated loan, if you have one, if you've already gotten to that point where you've consolidated something, it's really just got to be educational debt in there in order for it to be eligible for the Students to Service Loan Repayment Program. And again, that applies to all of our loan repayment programs across the board.
So Ron, we do have a question that has popped up in our chat section from one of our students, Fatima. And Fatima asks, if you are considering the scholarship program as an MD, does picking internal medicine mean you have to work in a clinical setting? Or could you work in the hospital if you're considering something like doing critical care in the ICU as an internal medicine doctor?
Yeah, so I think a great question in the internal medicine specialty that is definitely eligible, but you have to be in a clinical outpatient type of setting. Unfortunately, the approved sites wouldn't necessarily include critical care within a hospital. Again, just emphasizing it, it would have to be that clinical setting. Good question.
So kind of tying into that, regarding the site, so basically, I'm awarded a scholarship or I have the loan repaid, and then the NHSC picks which site I go to. Is that how it works?
So I think a good question. Not necessarily. It is not our goal to dictate where our program participants go to. You'll notice earlier in the presentation discussion, we had highlighted our Health Workforce Connector. And really, that's the first resource that a program participant would use when seeking out a site that works for them. Again, we have no interest whatsoever in saying, hey, you've got to go to this site or that site. We're simply trying to connect the resources, right? These qualified healthcare providers to communities in need. And whether that's a community in need right in your backyard or perhaps across a state line somewhere, we really encourage our program participants to select that practice site. I would say that we can certainly provide assistance, right? If an individual's having trouble finding that perfect practice site, we can certainly provide assistance as it relates to finding a practice site. But again, by no stretch of the imagination are we interested in dictating which exact site or health professional shortage area that a program participant goes to.
So Chris, just so I'm clear, would that also include federally qualified health centers, or maybe working at a private practice as even in the underserved community?
Absolutely. FQHCs are a big target area for us. The private practices are eligible as well. What we do have to be sure of is that that private practice has applied for and become an NHSC approved site. But that is certainly certainly another site type, are private practices that are out there.
Thank you. So if I'm awarded, once I am participating in the program and at my site, I'm basically volunteering my time because I've already got my loans paid off, or will I get a salary? How does that work?
That's a great question. So, for NHSC program participants, I think I can say the same for the Nurse Corps program participants. In terms of your salary, that is negotiated at market rate, right? You don't receive any reduction in salary because you're receiving loan repayment. You don't receive a reduction in salary because you were the lucky one that came out of school after having a scholarship and had very little educational debt. Again, it's a market rate in terms of your salary, and that would be negotiated with the site as you look for that practice site that you're interested in going to.
That's helpful. So,
Chris, I have heard stories of docs repaying back their time, and the former chief medical officer at a site here in Northeast Ohio, he did such a thing at a neighborhood family practice. He wound up staying there for over 20 years. Is that a common thing to see, or is that
Yeah.
a very unusual pattern?
No, it is very common, and I don't have the exact percentage. I know it's over 80% of our program participants actually stay in that health professional shortage area once they've completed their service commitment. This is something that we take great pride in because our overall goal, of course, is to connect, as mentioned, connect those qualified healthcare professionals to those communities in need. And we're hoping to make a long-term impact, right? So individuals that ultimately stay in that community, right? You have that 2 to 3 year service commitment. Often you'll connect with the activity, the community. You'll see some of Dr. Brian Freeman's experiences where they've connected. And again, over 80% of our program participants ultimately stay in that health professional shortage area that they were connected to.
so just a couple more questions, Chris, and then we can close out. So for both the National Health Service Corps and Nurse Corps programs, when are you accepting applications for those programs?
Both the National Health Service Corps and Nurse Corps scholarship programs, we tend to open those application cycles in March of each year. I wouldn't want to give the exact date. We're having policy documents reviewed right now, so we have proposed dates for this year. I think the best way to articulate it in this venue at this time of year is that those application cycles tend to open in March. And then the submission deadlines tend to be in late April, early May. And again, we have the QR code in there if you'd like to scan the QR code. That way we can have our programs send you an email notification once those application cycles are getting ready to open. As an aspiring healthcare professional, you've probably got many deadlines, many things to worry about. So by scanning that QR code, getting your email address into our system, we can be proactive and give you a heads up when those application cycles are opening.
That sounds great. So we actually also dropped into the chat a link. If you, and then Tony, if you're able to scroll back to the QR code, we can keep that on the screen for another minute or two while we're wrapping up. So either one of these, either the link in the chat or using your phone to scan the QR code will get you on our email list so you don't miss out on anything. So lastly, if I have a question, I haven't been able to get it answered here, or I just thought of something after this is over. Do you have any other ways to tap into asking questions?
Yeah, we really do. And I think our final slide is going to talk a little bit about the social media platforms that we're on. There's different contexts as to when you might have a question. Earlier in the presentation, we talked a little bit about our customer care center. If you're an applicant, that is typically the best way to reach out with any questions about your application is by contacting our customer care center. So really, there's a multitude of different ways that we can connect and get any questions that you may have answered.
And Chris, I think we have one more Q&A session coming up.
We do. For the Students to Service Loan Repayment Program, we will have a final all-day Q&A session at the end of the month. I think that's listed for November 30th. I don't know if anybody could drop a link into the chat, perhaps. And what we do in this venue is we open up essentially a Zoom room for the entire day, and we allow our applicants to come in and ask any questions that they may have about their application. With the Students to Service Loan Repayment Program, we'll do this 3 times throughout the application cycle. Once again, we have one last session left on November 30th, I believe it is. And that's about a week before the application deadline. So at that point, if you've got questions, you're probably stressed out, ready for a quick answer, and we will have our staff there ready to answer any question that you might have in an effort to assist you in successfully submitting an application.
That's fantastic. So just, is there any of our other presenters have anything that they'd like to say before we close out? Anyone from Nurse Corps have anything you'd like to communicate? This would be the time to do it.
Well, I'd like to personally thank Chris and the senior leadership team, Wendy, Sharon. Thank you so much for your time and helping to coordinate this info session. I work at the college level. I think it's never too soon to learn about your options for medical school early on in the process. So everything's not such a daunting task, but we look forward to broadcasting this info session out to our student population and other partners at other colleges across the Northeast Ohio region. So just a personal thank you for your time, and we look forward to hosting this once again.
Fantastic. Well, and likewise, of course, Dr. McKnight, it is super important to get the word out to folks about our programs. So we really appreciate your helping facilitate this and getting us connected with the students out there. Tony, I think we have one last slide that we'll use at the end just to kind of wrap things up and close out. All right. Thank you so much. So HRSA is also available on 5 social media platforms. We encourage you to follow along and share our content on Twitter, Facebook, LinkedIn, and Instagram to stay up to date on the latest HRSA news. Our account handle on each platform is at HRSAGOV. And we also encourage you to visit our YouTube page. We've got several different testimonials out there, such as the one we showed on Dr. Brian Freeman today, which will really help you sort of get a sense of experiences that individuals have had in our National Health Service Corps programs. With that said, I think unless Dr. McKnight, you had any final words, we will go ahead and wrap up today. I hope everybody has a wonderful rest of your day and wish you luck in your health professions training, and certainly encourage you to apply for National Health Service Corps or Nurse Corps programs in the future. I thank you so much, everyone, and have a wonderful day.